Hi everyone! The physiological aspect of the body that I'm going to be focusing on today involves bones, more specifically joints, and how movement is affected by arthritis. Our joints are any point in our body where our bones meet, whether or not the bones are movable at this border. There are four major categories of joints, and these are bony, fibrous, cartilaginous, and synovial. The two that are most commonly associated with arthritis are cartilaginous and synovial, and this is because cartilaginous joints have a space between the two connecting bones, and these are filled with cartilage. Similarly, synovial joints also have a joint cavity, and this is filled with synovial fluid. The article that I've chosen is about arthritis and presents evidence for the use of knee replacement surgery to relieve pain from arthritis. Arthritis is the term given for the medical conditions that affect the musculoskeletal system, specifically joints where the two bones meet. The most common type of arthritis is osteoarthritis. In normal joints, at each end of the bone, the cartilage is firm and rubbery, and it provides a smooth gliding surface for joint motion. But in osteoarthritis, the cartilage breaks down and it causes pain and swelling due to the bone-on-bone contact. As osteoarthritis develops over time, fragments of bone or cartilage can also chip off and float into the joint cavity, and this causes further pain. In the body, an inflammatory process occurs, and cytokines and enzymes develop that further damage the cartilage. Standard clinical management of osteoarthritis includes physical activity, dietary tips, and biomechanical measures, such as the use of insoles and drug therapy. However, the article suggests that total knee replacement surgery, followed by these non-surgical remedies, could give higher pain relief, enhance function and quality of life compared to non-surgical treatment alone. During knee replacement surgery, the surgeon takes out damaged cartilage from the bone and replaces the joint with a man-made joint. There are four basic steps to knee replacement procedure. First, the bone needs to be prepared. So this is where the damaged cartilage surfaces at the end of the femur and the tibia are removed with a small amount of underlying bone. Then the metal implants are positioned. So they're put where the removed cartilage and bone was, and it recreates the surface of the joint. The patella is then resurfaced. So the undersurface of the patella, or the kneecap, is cut and then resurfaced with a plastic sheath. And then finally, a spacer is inserted. So it's a medical grade plastic spacer, and it's put between the two joints, and it creates a smooth gliding surface as cartilage would or synovial fluid would. So in the article, an investigation including 100 patients diagnosed with knee osteoarthritis was carried out, and the participants were randomly assigned to either have a total knee replacement surgery followed by 12 weeks of non-surgical treatment, or just receive non-surgical treatment alone. After a period of 1 year, the group that underwent total knee replacement surgery and the non-surgical treatment showed improvement that is twice as much as the others in terms of pain scores, daily activities, and overall quality of life. About 2/3 of those who didn't receive the surgery still showed some significant improvement, but a quarter of this needed or required the surgery within a year of the study. So whilst these results do support the surgical intervention, there are obviously some risks associated with surgery. This includes infection. So this can occur within the wound or deep around the prosthesis, and it can happen immediately after the surgery or many years after, because any infection within the body can spread to the joint replacement. Blood clots. So in leg veins are the most common complication after knee replacement surgery. They do have the potential to be life-threatening if allowed to spread to the lungs, but generally it can be avoided with leg exercises, support stockings, or medication to thin the blood. Implant problems. So although implant designs and materials and surgical techniques are quite advanced and accurate, implant surfaces can wear down and the components can loosen. And finally, neurovascular injury. This is quite rare, but there can be injury to nerves or blood vessels around the knee during surgery, and it can be quite an issue for joint movement. So 1 in 5 people are at risk of arthritis, and unfortunately there are no prevention methods. So there are only general measures that can be taken to reduce the risks. So that includes a healthy diet, which includes seafood and regular exercise. So this study is quite significant as it does present a potential remedy for specifically knee osteoarthritis.